Hi, Jesse.
Hi, Evelyn.
Thanks for joining me today. I'm really excited to talk to you.
Thanks for having me. Good morning.
Good morning or good afternoon, whenever you're watching this.
Right.
The internet's magical. I'm here today with Jesse Hayman from Jack.org, a very important and well-respected mental health charity here in Canada, based in Toronto. Congratulations on everything going on, Jesse.
Thanks. We're doing our best to represent and support young people across the country. So
Yeah, and now more than ever, it's important. And a lot of the resources on jack.org I've noticed are for young people like in their 20s, but anyone at any age right now can really benefit from a little bit of mental health help. May is Mental Health Month after all, and we're in some unprecedented times.
yeah, I mean, it's a sorry. Go ahead.
No, Zoom, this is going to be like this. That's okay.
Okay. Yeah, I mean, it's a tough time for everyone right now. And I think like it's pretty important that we're all aware of just how tough a time it is. I know it's been a tough time for me to be stuck inside and not be connecting with people, and um, there was already enough to worry about prior to the pandemic in regards to our mental health. And it's more important now than ever that we're looking out for ourselves, but we're also making sure to check in and think about who's important that, or maybe struggling more than usual, and checking in on those people and understanding how. And we don't all understand how to do that. So I think that's Mental Health Month. It's an important time to really make us focus on our mental health because it's more important now than ever.
Yeah, I think that as a Yelper, talking to so many local businesses right now that are so affected and so many loved ones that I just want to know how to be there for them. And I know Jack.org has a wonderful organization that just launched a very big and very exciting partnership called Be There Today. Do you want to tell us a little bit about it?
Yeah, so we launched Be There originally. You can find it at bethere.org last May, and it was essentially to fill the gap between people that want to be there for people, because we're telling everyone reach out and ask for help, but realistically, they're not going to get the help they need professionally unless they can afford to pay for it for a long time. The waiting time is pretty high.
Yeah.
And on the other side, your friends and your family don't necessarily know how to be there for you. That's why stigma exists. And there was nowhere that was comprehensive and engaging to learn how. So we decided to launch it and make sure that the people that want to be there for those around them understand and have the education to do so. And then just a month ago, we've been in touch with Born This Way Foundation in the US for a couple of years, and they offer mental health first aid training, but that's in person. So they obviously can't do that anymore. So they reached out to us and basically said, listen, we've looked around. We obviously know you guys well. We think Be There is the next best thing that we can do, and let's try to bring it to our community and America. And so we decided to work together to do that. So we launched a campaign. It's called Be Kind, Be There. And that's the real melding of the two brands. They have a big push to be kind. And essentially what we're saying is you can be kind by just educating yourself and being ready to be there when someone needs you. And that's really what the campaign is about, is let's drive as many people in Canada and America as we can towards bethere.org and ask them to spend 5 minutes. It's really easy, but you really can learn a lot in 5 minutes. And if you want to spend 5 hours, you can also learn a lot more and understand how to support people in your life when they need you.
Okay, that's really exciting. First of all, obviously Born This Way is Lady Gaga's charity, and anyone is still with us into this Instagram, YouTube video, they are definitely a mental health advocate. So let's keep talking about this. What do you think the most important, I know there's 5 minutes on the bethere.org site is super easy for people to do, and I highly recommend doing it. But what would you say people need to know is like one really important snippet of how to be there for someone that you're a little worried about their mental health this time?
Yeah, the obviously at bethere.org you can figure out and go through all the golden rules. And I think the one that's most important to me, I guess the point I'll make is really a melding of two. The first is say what you see. It's something that we're all scared to do. If you talk to people that are worried about a friend or that sort of thing, they don't want to piss them off. They don't want to anger them. They don't want to make them feel judged. And that's why the first golden rule is so important. It's literally just say what you see. If I was in class with Evelyn usually and she's not showing and you're not showing up anymore, I'm going to turn to you and be like, I haven't seen you at class. Are you doing all right?
Yeah.
Or you play sports with someone and they don't show up. Or in this case, in COVID times, maybe you've messaged them a few times and they haven't responded. And pick up the phone and say, hey, you haven't been responding. It's unusual. Your behavior's changed. Or are you doing okay? And not just say what you see. The other part I would say is just listen and be curious. People are often wanting to like fix or solve something. There's nothing to fix or solve. It's not your role to fix or solve. You're a friend or a family, whatever it is. And if you can just listen, like really listen, and then be curious, ask questions. It shows the person that you're on their side, you're in their corner, and your job is not there to fix it. So just listen, and if you're curious, you can empathize and start to understand what they may be going through.
Thank you for pointing that out. I think that's a really important one. I know I'm a very extroverted mother, and so I'm always like, I got this, I'm gonna fix this. And especially now talking to loved ones and talking to business owners who are struggling, listening.
And
Curiously.
parents, I'm not a parent. I don't have that side, but like I work with a lot of parents and they're struggling too. It's really, really hard.
Yeah.
And I'm speaking just from their experiences, but seeing them, and I'm sure you can relate to this, of like to work and take care of your kids. And often in a family where you have two people working is really tough. There's someone that you could think about checking in on and saying hi to.
Yeah, I have no idea what my husband is doing upstairs with the 9-year-old or 9-month-old and the 4-year-old to keep them this quiet right now, to be honest, but I'm sure it involves bribery. So this is really exciting. Again, I want to send people to BeThere.org, but why don't you expand a little bit more from Be There into your work at Jack.org and all of your work with mental health experts. What are just some tips and tricks that you think people can do right now to help their mental health through this weird time?
Honestly, it's a tough question because there's so much that people can be doing. And my biggest piece of advice is to really check in on yourself. And it's simple to say that. And I think it's pretty simple advice that's already out there is like really be aware of what affects you positively or what's affecting you negatively.
Yeah.
And if you don't take the time to really think about it and really check in on yourself on how something's making you feel, whether it's your morning routine or the way you're interacting with people, then you can't know. So whether it's because you make your coffee in the morning, you go sit down too quickly and you're on screen time, and then you feel like crap for the rest of the day. Well, the other option is you can go for a walk in the morning and spend 10 minutes outside and see what that does. But really just take care of yourself, check in and know what you need. And also it's a great time if you're a little bit less busy to maybe think about like starting therapy or something like that. I know like I see a therapist and it's fantastic to have someone to talk to every day, or sorry, once a week or once every 2 weeks that doesn't need to say anything to you in regards to share their lives with you. You just get to spill, which is amazing. And, sometimes we can't find the time to do that. And maybe now's the time that people may have a little extra bandwidth to be able to talk to someone. But really just check in on yourself and take the time to think about what you need and do what's best for you. It's really great that people are out there giving advice, but I really think we just need to be super aware of ourselves at a time like this.
I think that's a very good point. I'd also like to say that if people don't seek professional mental health with a counselor or therapist already, there's so many people have pivoted to doing online or phone sessions, which are a little easier for people who are trying it for the first time. And Yelp is an excellent resource to find a therapist near you. Got to throw that
Absolutely.
in.
There's also group therapy too, and that might be something that's easier for people. And those are going online now too, which is honestly a really cool part of all this is that we're moving forward in such a great way for digital mental health, which is, I think, for the future, really promising.
Yeah, I agree. I agree that people that maybe were a little, I think there is a silver lining for people
Totally.
trying new things for themselves right now.
Mm-hmm.
And lastly, well, first of all, thank you so much for doing this.
Thank you for having me.
Again, but lastly,
thank Yelp for doing this.
Yeah, thank Yelp for doing this. Yelp's great. I know it's a tough financial time for people, so I don't expect you're getting a lot of donations, but on the off chance a family or a household is not affected and they do want to make some donations to help all of the wonderful mental health initiatives you guys do at Jack.org and Be There and Be Kind, where can they go to do that? Where can they donate?
So they can just head to Jack.org. We're, like you said, we're doing everything we can to try to support young people in any way they need, whether that's the people that need hope or self-care or understand how to be there for each other or social connection. We're doing the whole gambit. And so obviously, as you mentioned, a very tough time, but if anyone wants to, they can head to Jack.org and there's the donate button in the top right corner and support, but no pressure. I just really think the most important thing is we're checking in on ourselves and each other.
Okay, well, great. Thank you again, Jesse, and good luck with launching Be Kind and Be There.
Thank you very much, Evelyn. This was awesome.